About half of us will develop a cataract before our 65th birthday.
But that was not much comfort to Fred Becker. As a DeKalb County SWAT officer, he was worried that his cloudy vision would make it impossible to stay on the job.
Health Watch reporter Beth Galvin is here with his story. Beth?
Lisa and Russ, most cataracts start out small and then they grow, and that can eventually block out the light that our eye needs to focus. That's what was happening to Fred Becker. And this summer, he decided to finally do something about it. His DeKalb police uniform is almost like a second skin to Fred Becker.
I've been a police officer for 34 years. And I've been on the SWAT team for 33 of those years. And obviously, you've got to have, your vision has got to be good to shoot.
So to keep his aim sharp, the senior detective spends hours on the firing range. But at 58, Fred Becker had a problem. It was getting harder and harder to see.
It was blurry, and it was fuzzy, and it was like you were in a fog. So I couldn't focus. My shots were off.
Becker went to see Georgia Eye Associate surgeon Dr. Kris Gillian, who discovered he had cataracts, clouded over lenses in both eyes.
The average garden variety cataract looks like this. It's cloudy. It should look clear like the periphery is.
He said the only way that that's going to be corrected is through surgery. And of course, when he said surgery, you know, my knees just buckled.
By this summer, Fred Becker had acquired this entire bag full of glasses, but he still was having trouble seeing the target and reading stuff right in front of him.
I talked with my wife about it, and we came to the conclusion, look, if you want to continue in this line of work, you got to have it done.
So this summer, Becker underwent the same surgery 50-year-old Faye Campbell is about to have at Gwinnett Medical Center in Lawrenceville. She's sedated, her eye numbed, as Dr. Gillian breaks apart and removes her cataract, replacing her natural lens with an artificial intraocular lens, or IOL.
Well, up until very recently, we all had one implant style to choose from.
That old lens would only allow you to focus at one depth.
And afterwards, most patients would need glasses to see distance and definitely need glasses to see near with.
But Fred Becker chose a new type of lens that could sharpen his focus without the need for glasses. At about $2,500, the crystal lens allows him to see clearly up close, far away, and in between.
It was instant clarity. It was exactly like he said. It was amazing. Sit there here, aufliegen.
Becker is now back on the job, working with his canine partner Rocco, and grateful to be back on target.
I don't have to resort to the glasses anymore, and it works out really well for me. It was great. It was great for me.
And there are several multi-focus lenses that you can choose from, but unlike the standard lenses, premium lenses are not usually covered by your insurance policy, and that means you'll probably have to pay about $2,500 a piece. Fred Becker says the 20-minute surgery was pain-free, and he says he has no regrets. And Russ and Lisa, you know, you don't get a guarantee that you're going to be able to see at any distance, but a lot of people need the computer, and it gets really, really harder to see what you're looking at and see distance.
Yeah, precision is so important in his business.
Yes,
so,
it is.
You have to see,
yes,
you?
It is. He's really happy with what he got. I mean, he says it's life-changing. It's allowed him to stay on the SWAT team and do what he loves to do.
Good for him.
$5,000 doesn't sound like a lot for that, does it?
No, it doesn't.
All right, Beth, thanks.